Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel, today we're going to be talking about a live video of an implant surgery where we are doing an indirect sinus lift. Let's start. So this patient came to us with multiple teeth that had decay, especially the front tooth and the first molar on the upper right side. And we got to know after some investigations like the OPG that the bone in the 1/6 area was not too much, and that's where we decided to go for extraction followed by indirect sinus lifting. Now, sinus lift is a procedure that is done to elevate the sinus floor in order to get more bone length for implant placement. We did both the procedures under local anesthesia, and we replaced the crown of or the cap of the 1/1 within 1 week. And after the implant surgery and the sinus lift surgery of 1/6, we have left the implant in its place and we will operate on it after 4 months. So here is the video.
So in the following video, you can appreciate that we are planning to remove 2 teeth, that is tooth number 11 and tooth number 16. Here we are administering the local anesthesia. And after local anesthesia, we are starting to elevate the tooth with the help of an elevator and separate the gingival fibers so that we can luxate the tooth. As you can see that there is no pain or any response from the patient because there is adequate local anesthesia. With the help of the forceps, now we will use gentle movements to make sure that the tooth does not break. There was a lot of cavities that were proximally in this tooth, that is 1/6, which deemed it unrestorable with the help of an RCT and a cap. And of course, we have to augment the bone with the help of an indirect sinus lift. As you can appreciate, we have taken the tooth out and this is the grossly decayed tooth. That's why we can't do an RCT. Now we are examining the extraction socket, as we will do an indirect sinus lift with an implant placement. As the amount of bone present for the implant placement isn't adequate, we will go for an indirect sinus lift procedure. We are examining the socket to find out if there are any broken root fragments, and we are trying to remove the bony spicules with the help of an air rotor. At the same time, we are trying to access the maxillary sinus that has to be lifted with the help of indirect sinus lift technique. As you can appreciate, we are creating the area of approaching this sinus. There are 2 types of sinus lifts. That is direct sinus lift, where we do a window and we surgically lift the sinus, and there is an indirect sinus lift which we do through the sockets, and we will be using the patient's autologous blood here, as well as the bone chips that we are using. With the help of the air rotor that we're taking out the bone chips to make sure that we are using the autologous graft, basically the bone graft that has been created by the air rotor. We are using the bone chips released after the extraction, and we are using that same bone as a grafting material for the indirect sinus lift. Now we are examining the extraction socket and seeing that if there is anything else that we need to do. We are examining that if we have reached the sinus or not, and we use specialized instruments to see and to access the sinus. Now we are proceeding with the extraction, the atraumatic extraction of the 1/1 tooth, which is very grossly decayed and of course non-restorable with the help of an RCT and a cap, and therefore we are going to replace it with an immediate implant. Now the case of 1/1, we will extract it and place an immediate implant. In case of 1/6, we'll do an indirect sinus lift and place the implant, and the 1/6 will be restored after 3 to 4 months after bony healing has taken place. Now you can see we are giving the pilot drill into the extraction socket, and this is done under copious irrigation so that we can not cause any thermal necrosis of the bone because of the rising temperatures because of the pilot drill. As you can observe that we have started fixing the implant into the position, and of course this is a very technique sensitive procedure. Now we have lodged the implant, and now we will do something which is known as torquing, and this is how we will tighten the implant, and it will undergo osseointegration. That means the bone will grow around the titanium implant. As you can see, we are tightening the implant. This procedure is done under local anesthesia, so the patient is not feeling any sort of pain, and we are tightening the implant and torquing it so that we can appreciate that it is achieving something known as primary stability. This is the most important type of stability that is seen for implants. Now we are proceeding ahead with we have already accessed the sinus, and now we're doing the drilling for the second implant, that is in the place of 1/6, and this is also done under copious irrigation. The drills that are increased in size after every drill, there is a sequential increase in the size of the drill so that we can create that sort of placement for the implant. And now we are creating another partial thickness flap which we'll use for 2 layers of closure. After the sinus has been lifted and an implant has been placed, we will do a primary closure with the help of a partial thickness flap that we have created intentionally, and the final closure would be with the outer lip of the flap so that we can protect the sinus while it takes time to heal for the next few months and the bone can grow around it. Here we are creating the flap, and now we are doing the sinus lift procedure using specialized instruments, and this is one of the ways to ascertain that if the sinus has been lifted or not, and we are putting manual pressure so that we can lift the sinus and then place the implant. One of the things that patients encounter after sinus lifting is that they feel heavy around the nose. This is something that is relatively common and not something to be worried about. Checking for the final sinus lift, and then now we are placing the implant and tightening the cover screw, and after that we will do the suturing, and the cap of the patient was delivered for the 1/1 within 1 week, and the next surgery would be for the implant uncovering after 3-4 months. Thanks for watching.
So as you can see that placing implants in compromised bone also is not that difficult nowadays because of procedures and augmentative procedures that we can do. And in today's day and age, with the technology being so advanced, even if you have some sort of metabolic diseases such as diabetes, you can still go for implant replacement, and implant replacement is considered ideally the best and the safest way of replacing a missing tooth. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp and I will reply to your message after 3 or 4 days, because I get a lot of messages, I get a lot of love, and I get a lot of queries from patients. And if you have any queries, doubts, apprehensions, or insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.